Hello everyone, this is Sheena Anderson in Central Virginia with True Medicine, and I'm calling this season 2. I've finished the season on all of the top 10 medications that are prescribed in America today, and this week I'm going to be talking about hormone replacement therapy. Are we treating the problem or covering up the warning light? Today I want to talk to you about a topic that affects millions of people every single day, hormone replacement therapy. Now, before we begin, let me be clear, this is not a discussion about whether hormone therapy is good or bad. There are certainly situations where that might be needed. But the question I want us to explore today is much deeper than that. Are we actually treating the cause of hormonal dysfunction, or are we simply replacing hormones while ignoring what the body became imbalanced in the first place? You see, in modern healthcare, hormones have become one of the most common solutions for symptoms. Hot flashes, estrogen, painful periods, birth control, irregular cycles, birth control, low testosterone, testosterone injections, low thyroid replacement. The pattern is often the same. Find the hormone, replace the hormone, suppress the symptom. But what if the symptom was never the actual problem? What if it was a message? At True Medicine, we believe symptoms are communication. The body doesn't wake up one day and randomly decide to malfunction. The body is constantly adapting, compensating, and communicating. When hormones change, the body is actually and usually telling us that something deeper is occurring. So let's talk about menopause. Menopause has become one of the largest hormone replacement markets in healthcare. Women begin experiencing hot flashes, night sweats, mood changes, and sleep disturbances. Immediately, many are told they need estrogen. Now again, some women may absolutely benefit from hormone support. But here's the question I rarely hear being asked. Why are some women sailing through menopause while others are miserable? Could the difference involve inflammation? Could it involve stress? Could it involve adrenal exhaustion? Could it involve nutrient deficiencies? Could it involve poor sleep, blood sugar instability, or liver congestion? If we never ask these questions, we may miss the real story. We may calm the system while the imbalance continues underneath. Now, let's talk about birth control. This may be one of the most common examples of symptom suppression in modern medicine. Young women are prescribed birth control for acne, for painful periods, for irregular periods, for PCOS, for heavy bleeding, for mood swings, and often the symptoms improve. But what actually caused the symptom? If a young woman had insulin resistance driving her PCOS, has that been corrected? No. If chronic inflammation is driving painful periods, has that been corrected? No. If mineral deficiencies are contributing to hormonal dysfunction, has that been corrected? No. Many times all of these are no. The symptoms are quieter, the dysfunction remains, then there is testosterone replacement. Everywhere you look today, there are clinics promising men more energy, more strength, more drive, more vitality through testosterone therapy. But low testosterone may simply be a symptom. What if the real issue is poor sleep? What if it's obesity? What if it's insulin resistance or chronic stress? What if it's environmental toxins affecting the endocrine system? But what if the body is just exhausted and testosterone is simply the messenger telling us something is wrong? Adding testosterone may improve how someone feels, but if the root cause isn't addressed, the deterioration often continues. Now let's discuss thyroid hormone replacement. Millions of people take thyroid medication every day, and for many, it is necessary. And why is it necessary? Because they're trying to address a number. But thyroid dysfunction doesn't occur in isolation. The thyroid is connected to the adrenals. It's connected to the immune system. It's connected to the gut, and it's connected to nutrient status. It's also connected to the liver. So when someone develops thyroid disease, shouldn't we be asking why? What led to the dysfunction? Was it autoimmune? Was it chronic inflammation? Was it nutritional depletion? Was it stress? Was it toxicity? Replacing thyroid hormones may improve the lab numbers, but have we truly restored health? That's the question. One of the greatest concerns I have with our current healthcare system is that symptom suppression often delays discovery of the true cause. The body gives warning signs for a reason. Symptoms are like the check engine light on your dashboard. Imagine putting a piece of tape over the warning light. The light disappears, but the problem remains. This is what can happen when symptoms are managed without understanding the origin. Now, I want to emphasize something important. The goal of true medicine is not to make people feel guilty for using medications. The goal is not to shame anyone for choosing hormone replacement therapy. The goal is to ask deeper questions, because true medicine and true healing begins when we investigate upstream causes. What do I mean by upstream? Hormones are downstream messengers. Upstream causes may include nutritional deficiencies, chronic stress, poor sleep, toxic chemical exposure, heavy metals, gut dysfunction, liver congestion, insulin resistance, chronic infections, emotional trauma, and spiritual stress. These are the places where real healing often begins. At True Medicine, we're not asking what drug matches this diagnosis. We're asking what caused this diagnosis. The one question changes everything. It shifts the focus from symptom management to restoration, from suppression to understanding, from dependence to resilience. The future of healthcare may not be about creating better hormone replacements. It may be about understanding why so many people require them in the first place. Because true healing doesn't occur when a symptom disappears. True healing occurs when the body no longer needs to create the symptom. Thank you for joining me today. And if you have an issue that was listed in this and you'd like to know real solutions, place your condition in the bottom and I'll send you a private message. Have a great day, and remember, you were designed to heal. Trust the blueprint.